So actually, we just completed a clinical trial, which was published in PLOS One, a very prestigious peer-reviewed journal, and we tested the aspirin-containing product, which is classified as a drug, as well as the supplement product, which does not contain aspirin and is classified as a supplement. Both worked equally well to reduce symptoms, and we met our primary and secondary endpoints very well. The aspirin, and the reason for the aspirin, and aspirin is qualified as a drug by the FDA, so that's why we had to add those drug facts. But aspirin has chemicals called salicylates, which interact directly with COX-1 and COX-2 enzymes that are directly part of the inflammatory pathway that's involved in respiratory symptoms, the ones that cause respiratory symptoms. It works much better than any of the other NSAIDs, and actually there's more scientific research around aspirin for respiratory symptoms than the other NSAIDs. So that was the thought process for, the rationale for adding aspirin, but it works with the Biovanta spray, which is sold, and the lozenges, which have the immune complex that strengthen the respiratory lining and have the lysozyme and lactoferrin.
So basically, you use the immune complex to line the mucous membrane with lactoferrin and lysozymes. These are enzymes, I'm guessing, and these are already existent. You're actually adding more of them so that your general mucus could actually act against those bad bacteria that are going to cause infection. And then you also have wintergreen oil as well as menthol as little irritants or maybe some kind of antimicrobial agents that would probably help. A lot of companies nowadays are doing active ingredients together with natural ingredients just to get the drug claims so that they can call out some major call outs. Is that what incites you to do that?
What do you mean by call out?
Like, for example, aspirin, you can call out pain reliever and fever reducer because it's already a monograph of FDA. Is that the reason you are doing that too? Or is there a specific goal of adding the two together to actually get a better result?
Well, it's both. We're calling out because aspirin is a pain reliever and fever reducer, but it also works specifically on the biochemical pathway that is involved in respiratory inflammation. And I referenced this in the paper. So previous studies have used aspirin alone to treat respiratory symptoms, and they see an improvement of 25 to 30%.